am Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here, I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continue with the lifelong medication. Here, we learn of the approach for a patient who had diabetes for the last 35 years, hypertension 20 years, coronary vascular disease for the 18 years, and he has undergone a coronary artery bypass surgery in 2006 and undergone angiogram and balloon angioplasty in 2011 and 2020. Now in 2023, he has severe symptoms of angina and coronary CT angiogram was done and shows the calcification, diffuse calcification all over, and also aneurysmal segment, that is the coronary artery is dilating or becoming sort of ballooning out is also there. That means the muscles are get damaging and it's get weakened actually. And also the CT angiogram showed some complete blocked vessels also, especially the D1 and OM2 was completely blocked also. Along with this cardiac and other problems, he is having urinary problem also, and he is diagnosed with BPH, that is benign prostatic hyperplasia, for the last 6 years, and he is on medication for that. And also he is having arthritis, knee pain is there, finding it difficult to walk, and the shoulder pain. It is very common with the diabetic patients, the frozen shoulder, and also the spine, that the back pain is there, and the cervical and the lower back pain is he is suffering. And he is on insulin injections for twice a day, and 12 different types of medicines he is taking daily. In spite of all these medications, the patient is uncomfortable with cardiac pain. According to his cardiologist, operation like angioplasty or bypass will not help him. In such cases, further treatment option is only a heart transplant actually. Here I will try to explain how the surgery could be avoided, how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms, and progress evaluation based on corresponding improvements in the periodic tests. When we come to the details of the patient, he is a 65-year-old male, height 165 centimeter, weight is 74.9 kg, and his body age is 72. His accelerated aging is there, that is 7 years accelerated age is there. His abdominal circumference is 104. The abdominal obesity is there, and the fat percentage is 30.6. Ideally, it should be below 15. At least it should be below 20 at this age. And when he is diagnosed with the type 2 diabetes for the last 35 years. He is type 2 only, but he is on insulin. Ideally, there is no insulin deficiency, but he is taking so many medicines and insulin also. And hypertension is there for the last 20 years and on medication. And he had undergone a bypass surgery 18 years back, in 2006 actually. And after that also, he has undergone twice angiogram and balloon angioplasty. And no stent was inserted according to him. And that is in 2011 and 20. And he's taking benign urinary symptoms are there. Even with the medicines, urinary symptoms is there, and benign prostatic hyperplasia is diagnosed for the last 6 years. And arthritis is there, knee pain is there, and also shoulder pain and back pain, cervical, neck pain is there. And the current problem is actually in 2023 actually this patient came. And he had, because of the pain, a CT angiogram was done. That shows calcification and aneurysms, that is ballooning out of the part of the coronary arteries, that is the blood vessel supplying the heart. and also some part of totally block is there. Usually 90%, 80% block. Then some part of the D1 OM2 is totally blocked. And on blood test, he is having renal problem is there. His GFR is going down, and urinary albuminuria is there. And electrolyte imbalance also, this sodium imbalance, sodium is going down. And the abdominal scan shows he's having fatty liver, and this CAMT, that is for the vascular aging, what we used to do the coronary carotid intima media thickness. There is thickening of the carotid arteries, and also atherosclerosis is there. This usually this scans, CT scans, MRI scans and all is having some radiation or some dye has to be injected. So it cannot be used as a progress assessment. But this ultrasound scan and Doppler studies can be used for the progress assessment. So we usually do a routine abdominal scan, and also for the cardiac patients is a heart echocardiography and a CAMT, that is the coronary artery, carotid artery ultrasound scan also we usually take for the cardiac patient. So when we categorize this patient, it's a metabolic and degenerative disease. Actually, because of the old aging metabolic problem, the degeneration of the joints and this the disc, those are actually comes in the degenerative diseases. That is the basic problem for the degeneration is the metabolic disorder with the high sugar and the problems. He is actually taking 12 medicines are there. That is actually is on human mixed is there twice a day. And teneligliptin is diabetic medicine is there, and also some vitamins is there, multivitamins and minerals is taking, and atorvastatin taking 40 milligram daily, and Remistar is there, that is Urimax, that is Remistar, I think that is also for the hypertension, and Urimax is for this urinary problem with this prostate. Actually, it is only a symptomatic treatment, not for prostate enlargement. This medicine will not produce any prostatic enlargement. It will not affect, but only this slightly symptomatic relief may give. But on that also he is suffering from urinary problem. Then Pantolin D, that is for the gastric upset, and Clopilate, that is a blood thinner. Uvabid twice a day, that is for the angina pain. Rono is said, that is also for, that is the 1000 milligram, 1 gram is taking, that is also for the cardiac coronary, to dilate the coronary arteries to make it flow better. And Flaviderone or something like that is also for the angina pain. And because so many medicines are for the coronary pain itself. And when we come to the blood test, he is on insulin and all, but his sugar is reasonably controlled, that is 6.8 is the HbA1c, but the insulin level is high. And naturally, because he is on this insulin and all, it is high. And RBS also high, 197 is there. And that means there is insulin resistance is there. And his amylase level is high, increased, that means the inflammation, the pancreas is inflamed. And chronic pancreatitis is there. When the chronic pancreatitis, amylase and lipase is increased, the problem is actually the chance of getting a pancreatic cancer is high. And with the this statin also, he is having a triglyceride high and HDL low. And LDL is okay. This GFR is 78. It is tipped in the grade 2 renal failure is there. Ideally, the GFR should be more than 90. Now it has come down to 78. And microalbumin is there in the urine. And sodium is also low. That also shows the kidney function is compromised. And ESR is slightly high. Vitamin D is low. And his troponin level, that shows the muscular damage, cardiac muscle damage. That is troponin I is 126. That means there is really a problem with his heart. When troponin is high, that means you should be very careful. When we come to the symptoms, most important is cardiac pain, this angina pain. He cannot even take bath properly because he has to get support for taking bath, otherwise he get a pain. And also, if he cannot take a heavy meal, if his tummy is full, he gets the pain. And even if you get any constipation or any trouble with passing stool, also he gets pain. That much discomfort is there. And he's having walking difficulty because of the knee pain, and back pain is there, and gastric problems also, gas and acidity is also there. Then when we come to the clinically supported lifestyle corrections, so this sort of patients, what we do is, it's a type 2 diabetes. For the type 2 diabetes patients, we stop all the diabetic medicines on the first day itself. And other medications we stop or reduce according to the blood parameters, improvements in the blood parameters actually. And for what is actually done in the clinically supported lifestyle correction is we are ensuring all nutrition in the body, so that invariably this heart blood vessels and cardiac muscles are all damaged. So in cardiac patients, what we intend is, here the atherosclerosis is there, that is the fat is deposited inside the blood vessels. He is having a dyslipidemia, and the cholesterol is glucose is high. Glucose is damaging the blood vessels, and also this high fat inside the blood, that is dyslipidemia, this triglyceride, and all is damaging the blood vessel. So what we are trying to do is to give a low calorie diet, so that there will the low carb diet, so that the blood sugar will come down to normal without any insulin or other medication. And also when we give the nutrition in the correct proportion, the insulin resistance will stop. There is no deficiency of insulin, it is only the insulin resistance. Insulin is not working properly. Insulin cannot act actually. So when you give a correct nutrition and increase the activity and this circulation by doing physical exercise, but this patient and all cannot do much of exercise. So it's in clinically supported lifestyle correction, we give special food to ensure all the nutrition, and also special exercise in a phased manner to stimulate all the bones, muscles and bones in a correct, in a proportionate and manner, without straining the heart actually. It can be done in a lying down position or a sitting position, no running thing. So this we are dealing with patients with multiple sickness and movement restriction and pain, this sort of cardiac angina pain and all. And this what is the aim of this exercise actually? It's we call it as oxyflex. It's a very mild sort of exercise. The patients can do it and gradually build it up also. So when we do the exercise, the circulation will improve. So the fat or whatever toxins is, the blood will take the toxins also from the cells, and it also burn up the excess calorie, that is glucose also. That is our intention. Then we come to the result. Actually, this patient also, we have stopped all the diabetic medicines in the first day, but on the 8th day his HbA1c came down from 6.8 to 6.5 in the 8th day. Usually for the diabetic patients we say 3 months average and all, but the clinically supported lifestyle correction, initially we check the HbA1c every week actually. If the patient is following correctly, then HbA1c also will come down. Because we cannot rely on the blood sugar alone, because it depends on it will fluctuate according to the food. If you take some carb in between, we will not be able to know. So every visit we check the HbA1c also. So even this the patient is not telling the truth, we will be able to find it out. Then on the 15th day it came down to 6.1, and 30th day it came down to 5.8, and in the 60th day it is 5.5. But in 90 days it is slightly increased. That is because the patient is started deviating from the diet and all. So that also we will be able to know, because of the HbA1c. Actually in the 60th day it was only 5.5, and but 90th day it came up 6. That simply means that patient is deviating from the norms actually. Then initially the insulin level was 67.7, and RBS was initially when day 1 it was 67.7, 68 actually, and but in 30th day when we looked into insulin, it come down to 6.1. The insulin resistance is gone, but type 2 diabetes status is gone actually, and RBS was controlled within 24 hours itself, and when he came on 8th day, it was before starting it was 197, and the 8th day when he came it was only 97. It was throughout like that until 60th day it was like that, but on the 90th day he came, the RBS also high 151. Amylase was also coming down from 214 to 146 in 90 days, and the cholesterol and the triglyceride and all is normal actually in the 30. Gradually the medicines was tapered off, but it is all came down to normal, and GFR also is increased, and GFR came down 78. It was by 60 days it was increased to 92, and also the microalbumin and sodium level, that was actually kidney function, sodium, GFR, microalbumin and sodium level was lowering, but it was come down and stabilized by day 60. But again microalbumin reappeared and the sodium level gone down. That is because the patient has deviated from the optimal lifestyle actually. And vitamin D got corrected, that is with the correction it was come to normal. And when the cardiac patients, especially those who are troponin is very important on follow-up, and initially his troponin level was 126 and again came down to 86, and on the first week, second week just 34, 30 days it's 26, and troponin level come down to 20 on the 60, day 60, and troponin level is 16.8 to completely normal by 80. Actually for this angina patients, it is troponin level will start coming only gradually, this for the block patient, but for the attack patient we have seen 5,000 and 6,000 and all, it will come down to normal within very fast, within a week or within a month or so it will come down. But for this block patients, this angina type of patients, it will come down only very slowly. When we come to the symptomatic relief, his chest discomfort was reduced to 60% by the 8th day and 80% by the 15th day, and by 30th day it was almost gone. And walking difficulty by the 8th day it was got, knee pain and all is gone, back pain by 50%, and 15th day it is 70%, and by 30 days it is all gone. Actually one new symptom came actually was on the 8th day was his BP is getting low actually. That is mainly because of the BP. There's so many cardiac medicines are there, no? So it all reduces the BP. So that is why, and also the sodium is low. So then when we came to that is BP is going down just because of the medication. So and these BP patients, we monitor the BP, and as much as early as possible we can try to come down the BP medicine also. But here problem is main BP medicines are for this heart, so we cannot just reduce that. So we ask him to take what are the precautions to be taken to not especially that this orthostatic hypotension can occur. If you are sitting for a long time, then get up, suddenly it will take some time to adjust with the BP, or what BP adjustment, or when lying down. And also he is on the other medicine for the Urimax, that is for the urinary problem, that is also an alpha blocker, that can also reduce the BP. So many medicines actually, his Avas, that is statin, was reduced gradually from 40 to 20, 10 and then 5, and then alternate day, and stopped by 60 days. Then Remistar, that for the BP, that is also reduced and stopped by within a month itself, 30 days. Urimax stopped by 15 days, and 30th day, 15th day there is no Urimax, that is for the urinary problem. And he's improved with the symptoms also without medicine. And Pantox was continued till this Copilate, that is blood thinner is over. It is by 15th day, that also, because that also was reduced actually. Copilate was reduced by 15th day because he's, and the other acidity medicine also. This angina medicine, Rano, AZ and all, Flavidrone and Incostar and all, which is reduced. First Ivabit is reduced, then the other one is reduced, and by the end of 30 days it was there only that Nicostar was there in that group, and that also reduced and stopped by day 60. All the medicines are over by day 60. We'll see what are the changes which has happened in the body actually. It's a gross level. See, actually, in clinically supported lifestyle correction, we are trying to correct the body in a macro level and at a macro level, and the cellular level, and also in the gross level. He was obese, and especially the abdominal obesity was there, and his BMI was 27.5, and in the day one, the body weight was 75, that is reduced to 65.8 in the 90 days. Actually, that is slightly low. Actually, we are expecting around, if the patient is doing everything in the correct manner, he should be able to get a 20% reduction. That is, he can reach 60. And actually, the last week he was not doing, last month he was not doing, last 2 months, first initial month he has reached 10% actually reduction. It is very good, but after that he is slightly actually slight deviation, exercise and all not doing properly. And BMI 27.52, he reduced to 24.2, and BP was maintaining. He was, with medicine he was 130/70, and without medicine he was able to maintain his 120/80, and abdominal circumference was 104, and he was able to come down to 90. That is also not that good. It should have been, if it is trying his best, he would have come down to around 85. There are patients like that, around 85, 80 and all, it is possible. And body age, he was accelerated body age. It's only 65 years, but initially his body age was 71. Actually, in 1 month, 30 days, it has come down to 63. And again, by 90, it came down to 58. With the clinically supported lifestyle correction, you are not reversing the disease like diabetes and heart disease and all. You are reversing your body age also. That means it's an anti-aging also. So within 90 days, he is able to come down from 71 to 58, almost 13 years. And fat percentage 33.6 to 26.5. So what we expect in the next 3 months is actually his ideal. He should maintain his body weight around 57 and BMI around, at this age with all this disease, even this, you should understand that the coronary arteries, even there is ballooning and aneurysms are there. So he has to come down to 21 BMI and maintain blood glucose also in the normal range, and abdominal circumference preferably to 70 with his, according to his height. And body age, he can maintain below 50 actually, and fat percentage below 20. Actually, when he came for the 90th day, he also started, he has not stopped all his business. He's doing some business. He stopped all the business for the quite a long time because he's not able to do anything. Now he's restarted also his business and he's able to function properly. Only thing, he's not able to focus on, when he started doing this thing, he's not able to focus on the correction, and he started taking other food and all. That is the only problem. But hopefully he know what is the difference. With all the medicines he has no relief, but now without any medicine he's cleared of the discomforts and all. And when we summarize this patient, he is suffering from a lot of problems and there is no solution in modern medicine. Even though he has tried all the things, already he has undergone bypass, angioplasty many times, and but he's suffering from, and now his only option is if you want to get relief, only option is a heart transplant. And that is not transplant, getting a heart for transplant is very difficult, and also with all this his problems, it is not that easy. So he is basically, even such patients, whatever you want to convey is even these difficult situations, if you are willing for a lifestyle correction, you can reverse not only the diseases, and you can reverse your aging process, and you can become younger. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications. To protect your children, grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.